It was the early June Canadian wildfires and the impact on our air quality, which was terrible. When smoke descended on New York last month, New Yorkers were shocked to see the sky blotted out and find the air was dangerous to breathe. They looked to state and local leaders for guidance during this unprecedented incident. However, to many people, it appeared that our local executives and agency chiefs had little advice to offer on how to stay safe or aid to provide. We seem behind the curve, at least to some people, and I know that's what we're going to be discussing today. In fairness, this was an unprecedented challenge that city agencies had not ever confronted before. Some would say it was, however, foreseeable. For years, scientists have warned us that rising global temperatures would lead to changing weather patterns, climate disasters, direct harms to our health. And mayoral administrations over years have focused public health agencies on monitoring air quality, and we'll talk more about that. The early June wildfire emergency was the first of its kind, but it didn't come out of nowhere. The threat posed by the smoke from the wildfires and when. We need to know how the mayor and the city agencies acted on the information and whether they took advantage of tools and expertise to meet the challenge as early as possible. And we need to know how this information was evaluated, what the response to the air quality emergency was to make sure that we have good information in the future. We need to also understand how the administration plans to meet crises in the future. This was the first of its kind, but it won't be the last. Threats to air quality are one part of our new environmental normal. We also have rising sea levels, as we know, heat, storms. We have to plan for these threats. We have snowstorms. We have all kinds of irregular weather events. Like the June smoke emergency, it's challenging and it's scary, but we're capable of rising to these challenges. Before we begin, I would like to thank the Oversight and Investigations Committee staff, Council Nicole Cotta, Policy Analyst Alex Yablon for all their hard work, certainly members of the OID Division, Director Aaron Mendelson, Deputy Director Meg Powers, Counsel Kevin Frick, Lead Investigator Zach Maher, and my staff, Sam Goldsmith, and I'd like to now turn it over to Health Chair Lynn Schulman.
Thank you, Chair Brewer. Good morning, everyone. I am Councilmember Lynn Schulman, Chair of the Committee on Health. I want to thank all of you for joining us at today's joint oversight hearing. The purpose of today's hearing is to examine the city's response to the first air quality emergency in early June, and to also discuss how the city can best respond to such emergencies, communicate effectively with the public, and protect the most vulnerable New Yorkers going forward. With wildfires proliferating around the globe, it's indisputable that very poor air quality from wildfire smoke can contribute to adverse health effects, even for those who are considered reasonably healthy. According to the CDC, breathing in wildfire smoke can have an immediate impact, including coughing, trouble breathing normally, stinging eyes, headaches, fast heartbeat, and chest pain. Older adults, pregnant people, children, and those with pre-existing respiratory and heart conditions may be even more likely to get sick from breathing in wildfire smoke. According to data provided by the Department of Health and Mental Hygiene, asthma-related emergency room visits increased during the first air quality emergency in early June, an increase not seen since April when tree pollen levels were at their highest. As the chair of the Council's Committee on Health, it is my responsibility to ensure that the well-being of all New Yorkers is sufficiently addressed and that New Yorkers are armed with the necessary information and tools to protect themselves during these types of emergencies. What we witnessed in early June with dangerous air quality levels was unprecedented. Clearly, this is not something we have previously experienced, and the city responded in the best way possible, given that the most reliable data that was available about air quality was limited. That said, we can certainly do better. Air quality emergencies appear to be a new norm for New York City, and we must be prepared. Today, I'm looking forward to hearing from the administration on the lessons we've learned from responding to this public health threat, as well as from the public on how we can best protect the health of all New Yorkers going forward. I want to conclude by thanking the committee staff for their work on this hearing, committee counsels Chris Pepe and Sarah Sucha, and policy analyst Manor Butt, as well as my team, Chief of Staff Jonathan Boucher, and Legislative Director Kevin McAleer. I will now turn it over to Chair Genera for his opening statement.
Thank you very much, Chair Schulman and Chair Brewer. It is a real delight to be able to co-chair this hearing with you. Thank you very much for having me. Good morning. I'm Jim Genera, Chair of the Committee on Environmental Protection, Resiliency, and Waterfronts. And we're here today, as you know, with the Committee on Oversight and Investigation and the Committee on Health to examine the administration's response to the air quality emergencies that have occurred this summer. The Canadian wildfires have made it painfully clear that the city needs a robust response plan for events such as these. Much of my statement has already been said. I'll try to cut it back. Fine particles, that is particulate matter, 2.5 microns or less, what we call PM 2.5, are the main pollutant in wildfire smoke and pose the greatest health risk, as the small size enables these particles to penetrate deep into the lungs and enter the bloodstream. Many studies have shown an association between exposure to particulate pollution and severe health risks. Also, volatile organic chemicals in wildfire smoke can interact with sunlight to form ozone. That's the phenomenon that's happening today when you have VOCs that mix in extreme heat and create smog or ozone, which is an irritant to the lung. Exposure to ozone can cause headaches, coughing, dry throat, shortness of breath, worsening asthma symptoms and fluid in the lungs, higher level of exposure leading to more severe symptoms. You get the idea. Children are at greater risk from exposure to ozone because the lungs are still developing and they're more likely to be active outdoors, and ozone levels are high, which increases their exposure. And they're also more likely than adults to have asthma. New York City must warn residents prior to when air quality is unhealthy, if that is predictable, like it was today, when we know the temperature is going to be X and like the surface conditions are Y, and you add that and you have an ozone alert like we have today. So New York City must warn residents prior to when air quality is unhealthy. Ideally, this should take place several days in the case of the Canadian thing before there's likely to be an air quality emergency, so that residents have sufficient time to plan accordingly. We must also make sure that the city has a plan to distribute the necessary PPE and PPE efficiently and broadly, particularly in the most vulnerable communities. We've known that climate change means more severe weather events will continue happening with increased frequency. Let this serve as a wake-up call that emergency preparedness planning needs to look beyond the threats from hurricanes and sea level rise. Before I turn it back over to the chairs, I'd like to thank the great committee staff who have done great work over the years. To my right, we have Council Samara Swanson. She's terrific. Legislative analyst Claire, help me out there. McLaughlin, is that right?
McLaughlin.
She's new, right?
Yes.
Okay, she's new, but very good. This is kind of an open thing. I just, you get what you get with Jim Genera. Legislative analyst Claire, I just said her. Policy analyst Ricky Chawler, my buddy, and Andrew Bourne, also my buddy. Financial analyst Angela Lane Lawless, third buddy. And finally, my legislative director, the great Nabby Kaur, for all their hard work. I'd like to shout out the members of my committee that are here. We have me, and we have Councilmember Nurse. I would expect other members of the committee will be joining us, and it's also my understanding that I spoke to the DEP commissioner, and he indicated that someone from DEP was going to be available to answer questions. Okay, great. Oh, Beth. Okay, it's going to be Beth. That is great. With that, I'll turn it over to the two chairs, and once again, I'm very grateful to be part of this important hearing.
Thank you very much. Now we're going to hear from Public Advocate Jamel Williams based on his report and opening statement. Thank you.
Thank you so much, Madam Chair. As mentioned, my name is Jamel Williams. I'm Public Advocate of the City of New York. I'd like to thank Chair Schulman, Brewer, and Genera, and the members of the Committees on Health Oversight and Investigations and Environmental Protection, Resiliency, and Waterfronts for holding this important hearing. Also, Commissioner and the administration for being here. Just 4 weeks ago, our city faced an unprecedented air quality crisis when smoke from over 400 wildfires in Canada were pushed into our city. Unlike our West Coast sister cities, who routinely deal with wildfire smoke and its harmful effects due to drought and long wildfire seasons, New Yorkers were not prepared for the poor air quality that arose during the week of June 4th. The COVID-19 pandemic should have prepared us in delivering speedy and accurate communication around this issue. Instead, there seems to have been failures to respond to this event, and I think that was not just on the city level, but on all levels of government, state, and federal. Over the past few weeks, my office has been corresponding with officials from the West Coast municipalities like Seattle, San Francisco, Los Angeles, Santa Barbara, and San Diego, some who may actually be viewing us remotely, gathering best practices and resources on how New York City can best respond to this crisis when it arises in the future. As we've seen over these past few weeks, with a mere shift of the wind, wildfire smoke has the ability to impact New Yorkers' daily life, and we must be prepared to meet those instances as they arise. From these conversations, we compile a list of recommendations which can be read in our report, Orange Sky Red Alert, that we urge our city and state partners to implement in order to proactively respond to these air quality issues as they arise. This report also finds shortcomings in the city's response to air quality emergency, and particularly the lack of speed and scope of public information system and hazard mitigation efforts. As we've seen, climate change is rapidly reshaping natural hazards at an alarming rate of pace, and it will not wait for us to be prepared, but it's no longer enough to reflect and develop plans for what we've already encountered thus far. We must also anticipate and prepare for the unforeseen in order to keep our city safe and healthy. I do want to just say, notwithstanding the mayor's comments that folks are criticizing just to criticizing, nothing can be further from the truth. It is part of my job to make sure that we review and look at what the city's doing and that we can do things better. I also just want to put out there the same that everyone is saying. I don't think there's any way any of us could have been prepared for a sky on fire and the level of how poorly the air was at that moment in time. What I had focused on is preparation, information, and communication. And it does seem that we were not prepared to communicate as effectively and accurately as we could have. But I noticed in the op-ed that information was sent out there. I think that is true. I just want to make clear, as we did, notify NYC is not the most effective way to put information out there. When the Yankee game happened the day before, we had reached levels of 200. And so they should have been more urgent and effective way to let people know how bad the air quality was at that time. When it is 200, it is dangerous and starting to be dangerous for members of the public, not just those who have underlying conditions. During COVID, we saw press conferences daily that helped us back up our communications. I think had the mayor, commissioner, and others done a press conference sooner and really lifted and dug into how bad the air quality might be, we would have been in better space for people to understand what to do and when the sky caught on fire, even though we may not have been able to prepare for that. So thank you so much for this opportunity, and thank you to the council for having this hearing.
Thank you very much. Other council members here, Councilmember Narcisse, Councilmember Ariola, Councilmember Williams, and on Zoom, Councilmember Holden, Ayala, and Salamanca. And now we'll have swearing in.
Thank you, Chair Brewer. We will now hear testimony from the administration. We will hear from Emergency Management Commissioner Zachary Esco, DOHMH Deputy Commissioner for Environmental Health Corinne Schiff, and DEP Deputy Commissioner Beth DeFalco. Before we begin, I will administer the affirmation. Panelists, please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions? Thank you. You may begin when ready.
Good morning, members of the City Council. I am Zach Esco, Commissioner of New York City Emergency Management. And I am here to discuss the air quality impacts to New York City during the first week of June 2023, as well as subsequent air quality events that we expect to continue into the future. I am joined today by New York City Department of Health and Mental Hygiene Deputy Commissioner for Environmental Health, Corinne Schiff, and DEP, Department of Environmental Protection Commissioner for Public Affairs, Beth DeFalco. Before we delve into the specifics, I would like to take a moment to acknowledge the broader environmental challenges that our nation is currently facing and grappling. In the Southwest, an intense heat wave is testing the resilience of communities, while the Northeast is witnessing extreme rainfall events. These conditions are not isolated, but part of the larger climate issues we must face and address. In the midst of these extreme weather events, I want to profoundly express my deepest gratitude to the first responders, public servants, and all of those who are meeting these challenges head-on. Their tireless efforts in these trying times exemplify the best of human spirit and determination, and I am so grateful that people like them exist. In the midst of these extreme weather events, now let's move on to our main discussion today about the air quality impacts in New York City and how we can mitigate and adapt to these conditions for the welfare of all New Yorkers and the communities that they are part of. As climate change unfolds in real time, monitoring the air quality index is and will remain part of our new normal. This became jarringly obvious when orange smog from the Canadian wildfires blanketed our city last month. The good news is, if New Yorkers take some simple precautions, we can help prevent or limit the health impacts of these air quality events, but only if we work together. Our city's response to the wildfires serves as a good blueprint for future events. About a week before the air pollution from Canada's wildfires began permeating the 5 boroughs, public messaging about the incoming hazards and guidance for protecting oneself began. Immediately after, hundreds of thousands of masks were distributed to firehouses and police precincts across the city, where they remain available to all New Yorkers today. Hospital visits and EMS response times were closely monitored. Ferry schedules were adjusted. Outdoor events and activities were modified. And we coordinated closely with the Department of Health, Department of Social Services, Mayor's Office for People with Disabilities, the Mayor's Office for Immigrant Affairs, the Department for the Aging, and others to ensure the people most at risk, from our elderly to delivery workers and people with special needs, had the information and resources that they needed to stay safe. Throughout it all, essential services like sanitation and transportation were uninterrupted. Forecasting air quality indexes, especially for smoke, is incredibly difficult and complex and is only available less than 24 hours in advance by New York State's Department of Environmental Conservation. The AQI forecast for Tuesday, June 6th and Wednesday, June 7th never placed the AQI in the red or the unhealthy category for the general population. June 7th, the day Mayor Adams held the first of 3 press conferences on the subject, was the only day we saw AQI hit what is considered hazardous levels. Still, with advisories in place for sensitive groups, our team and agency partners began messaging warnings and guidance as far back as June 1st through Notify NYC and other channels. Notify NYC has been providing air quality alerts since 2009 with an AQI threshold for issuance of 100 or higher. With more than 1 million subscribers and availability in 14 languages, including English, Arabic, Bengali, Chinese, French, Haitian Creole, Italian, Korean, Polish, Russian, Spanish, Urdu, Yiddish, and American Sign Language, this is the city's primary emergency notification system. Emergency management is responsible for the development, maintenance, and oversight of dozens of emergency plans, protocols, and playbooks for the City of New York. Emergency plans help prepare the city to respond effectively during an incident in order to reduce disruptions to people and services. NYCM creates and updates the city's emergency plans for a range of hazards and functional areas that support events such as the recent air quality emergency. Air quality is something we have long monitored and built into our response procedures, but tied to more common causes such as heat-related ozone pollutants. This wildfire was an anomaly for the New York City region, but we had the tools to pull from to stand up and address the response in a time of need. These plans are scalable, flexible, and are made up of a menu of operations and response options. Since no 2 emergencies will ever be the same, having a menu of options that can be used for a wide variety of incidents and hazards is essential, especially for new to New York City events like wildfire-induced air quality emergencies. For example, a response for a hazard can require multiple plans be used. A coastal storm can trigger over 20 operational documents, such as the Coastal Storm Activation Playbook, the Coastal Storm Sheltering Plan, the Coastal Storm Evacuation Plan, the Logistics Section Plan, the Debris Management Plan, the Interim Flood Protection Measures Playbook, Disaster Assistance Service Center Plan and Manual, and the Citywide Health and Safety Plan, amongst others. A winter weather event can include turning on our Winter Weather Emergency Plan, Flash Flood Emergency Plan, our Power Disruption Plan, our Tow Truck Task Force Protocol, the Advanced Warning System Protocol, or Emergency Public Information Protocol. An earthquake event could require turning on the Advanced Warning System Protocol, the Area Evacuation Plan, the Commodity Distribution Plan, the Debris Management Plan, the Disaster Assistance Service Center Protocol, or the Healthcare Facility Evacuation Plan. No matter the event, we can leverage strategies and tools from our plans to quickly coordinate the response to an event. This includes identifying the key partners for operational coordination, holding interagency calls to provide situational awareness, monitoring and tracking impacts to critical services and infrastructure, identifying key decisions and resources needed to reduce impacts from the event, and tracking key actions to support the response by agency partners. For the air quality event in June, we pulled response operations and capabilities from a wide range of pre-existing plans based on the needs of the emergency at hand. This is similar to what we do during many other extreme weather emergencies, as well as how we operate for any other novel event. For example, during this event, we used the Advanced Warning System Protocol to enhance communication with and outreach to vulnerable populations. We used the Emergency Public Information Protocol to notify the public via Notify NYC and other channels. We use the Citywide Incident Management System to conduct interagency coordination based on specific core competencies of our agency partners. We use the Citywide Health and Safety Plan to coordinate environmental health and monitoring and citywide worker health and safety coordination. We use the Hazard Mitigation Plan Extreme Heat Profile to assess the relevance of historical events and risk factors of air quality. We use the Heat Emergency Plan to coordinate outreach to vulnerable populations, the healthcare system, and homeless populations, as well as coordinate with outdoor events and conduct syndromic surveillance. We use the Logistics Section Plan to source and coordinate the distribution of hundreds of thousands of masks. We use the Winter Weather Plan to discuss school closures. All in all, we issued 11 Notify NYC messages, held 4 press conferences, 3 interagency citywide incident management system calls, distributed over 100,000 masks, and responded to dozens of press inquiries. Ultimately, the best evidence of a successful response comes from public health data, which saw emergency room visits involving breathing complaints just 100 visits above seasonal averages on the day with the worst AQI rating. 100 visits above seasonal averages in a city of more than 8 million people. This is similar to increases we observed in April due to pollen season. While our goal is to keep emergency room visits as close to zero as possible, it is my firm belief that it had not been for our team, our agency partners, City Hall leadership, and the smart precautions taken by millions of New Yorkers, that number would have been far higher, and the impacts to our most vulnerable far worse. After any emergency, our team conducts thorough after-action reviews to improve our response in the future. This crisis was no exception, and we will continue to pivot and shift our response to ensure New Yorkers are best served and protected. That said, I am incredibly proud of our robust response. We continue to coordinate across all agencies to distribute masks, share information with delivery workers and immigrant communities and others about staying safe, provide the best advice to New Yorkers, intensify outreach to unhoused New Yorkers, and much more. This was not a one-time standalone event. The summer is far from over, and more air quality events are likely to come both this year and in the future. As we have seen with other aspects of severe weather, climate change and its impacts continue to pose new challenges to New York City. And our city agencies are working to adjust our plans and outreach to New Yorkers to address this hazard and others. As we did with this incident, we continue to lean forward in messaging to New Yorkers the most up-to-date information of the potential dangers from poor air quality so they can make any adjustments to their activities as needed. Thank you for this opportunity to testify today. We will now take your questions.
Thank you. We've been joined by Councilmember Ressler also. So my first question is, there's a lot of discussion about June 1st, as you indicated, and I'm certainly a NYC member in terms of notifying. I must admit, and this is, I think, true of many New Yorkers, 1 million you said who are members, is that we tend to discard it because we do get a lot of missing persons and other pieces of information, and I have to say I don't pay as much attention to it as I should. So I just want to let you know that I assume that's true of other people. So that's one way to tell people, but it's not always the most effective, just to be honest with you. So I do want to know, in addition, sort of why did your agency wait until June 7th to start drafting a protocol? Because this is my understanding for air quality emergencies, when you did state, and you've done that in the excellent op-ed in the Daily News today, that you said that air quality alerts were sent to New Yorkers beginning on June 1st. And the reason I also want to mention that is I want to understand a little bit more about, because you did mention a lot of reports, and it's hard to, I'm sure, staff-wise, keep up with all the different places that you are keeping information in. But I also understand that DCAS, to their credit, has a guidance for what people should do in these kinds of instances. And it's my understanding that it was sent out, but not all the agencies followed it or knew to follow it. My understanding that Parks did a great job. They alerted particularly survivors of 9/11. And I think one of the reasons this is so important today is those of us who are here on 9/11 are still concerned about air, because we were given, at that point, I'm not saying this is true with the city, but the feds gave us really bad information. And so Parks did a good job. My understanding is the fire department had Medal Day at the, probably in Councilmember Schulman's district, at the tennis center, but, and people were participating even though the air was of very poor quality. Broadway had closed down. The Department of Transportation had workers on the highways, even though much of the major sports leagues had closed down. So I guess my question is, very specifically, June 1st, exactly what you were telling people, and then it didn't seem to be happening in terms of the information came out very late on June 7th. So how do you reconcile all of this different information? Because that's what we're hearing. Very, I would say, uneven, either information getting out or how it was adhered to. Yeah. That seems to be the problem.
Thank you for your question. So I think part of this is an understanding of the forecast constraints, and part of it is an understanding of what we do at different air quality hazard levels. So the Department of Environmental Conservation, a New York State agency, is the agency tasked with monitoring and doing forecasting for air quality. They have a remarkable team. I don't want this to sound at all like I am throwing them under their bus. Their meteorologists are fantastic. Forecasting air quality is very, very difficult to do, and scientifically is very complex. Each year, we face up to dozens of days where the air quality index is forecasted to go above 100. That's the level that DEC then issues an advisory. When they issue the advisory, there is specific messaging we do. One of them is Notify NYC. At different levels, there's other things we do, and I want to make this clear. Notify NYC is the primary, but not the only messaging system that we use. We have Strengthening Communities programs in place where we tap into local nonprofits and community-based organizations. We do a lot of outreach to electeds and to others. We can hold press conferences. There's a lot, we have social media. We do a lot more than just Notify NYC. But on June 1st, just like we do dozens of times in the past when this has occurred and you have an air quality advisory because of an index over 100, that's the protocol. June 7th was the day that we hit hazardous levels of air. Again, the forecast for June 6th, the day before, was 118. We hit, I think we hit maybe 218 on June 6th late in the day. The forecast for June 7th was, I think it was, the forecast was 138. Both of those are in the unhealthy for sensitive groups, but not the unhealthy category. And so based on the forecast, we started to amp up some of the work that we were doing, some of the coordination, some of the messaging, but a forecast of 184 on the 6th for the 7th and then hitting 484, we didn't have a forecast telling us that we were going to hit hazardous levels. And as soon as we did, the day that the mayor held the first press conference was the day that we had the first indicator of hazardous levels of air quality. And so I think that's why, we have to trust the science. We have to trust what we can do within the constraints of the forecasting abilities. And that's what we did in this case.
All right, but how, between the 1st and the 6th, do you know if other locations did a better job, perhaps, of indicating that this was going to be a hazard? It doesn't feel like there was a concise understanding of what was going to happen, because the day it almost happened, by the time the information was circulated, the worst.
I mean, again, I would point to the forecast, right? If the forecast is telling you that it's going to be unhealthy for sensitive groups, and you end up in the hazardous levels, we have to go with what the science is telling us, right? I don't know how to tell you what we could do better based on what the forecasts. I can't predict the future other than what the forecast is doing. I think we also have to operate with the understanding that these forecasts are very unreliable, and there's a lot of complexity to them and difficulty. Forecasting any weather event is difficult, but air quality in particular air quality caused by smoke, is notoriously difficult to do. And again, I think how off these forecasts were will point you to that, and that is not at all a slight against the remarkable meteorologists at DEC. It's just where we are with the science of forecasting air pollution.
So on the evening of the 6th, when it was unhealthy and very unhealthy, why not message then? In other words, or the other question would be, how would you do it differently in the future?
Well, I think we started messaging even earlier on the 6th through a number of different channels. And again, the mayor's first press conference was, you're not going to do that at 10 p.m., you're going to do that first thing in the morning, which is when we did, but we were messaging through a whole host of other channels. Okay. But I will say, we should not be knocking Notify NYC either. It is not the only message channel, it is our primary one, and I encourage all New Yorkers to sign up for it.
Okay. It is
one other, just Chair, if I may, the comment about missing persons, I think that's actually a city council mandate that we do the citywide alerts for that.
I know, but what I'm saying, whatever it is very constant and has many different notifications. And so, to be honest with you, I don't think people paid as much attention as you think they should or did. And I don't think that should be your only location of telling people about such challenging air conditions, not to mention other emergencies. Did the governor indicate earlier than the city as to when the air conditions were hazardous?
Well, we rely on her administration's forecasting, so it is their forecast that we use to.
But I think that the governor actually announced earlier than the city when this air was going to be hazardous.
I don't know. I don't have recollection of that, but I'm happy to go back and look.
What is the determination made to send a Notify NYC alert? What would have precipitated that on June 1st or any other day? When did you decide to do that?
Air quality, an AQI forecast of 100 or more.
100 or more, and that's what you would do? That's what you said that.
So if DEC issues an air quality advisory, that is the trigger for us issuing a notification.
Okay. And when you talk about the hospitalization being pretty normal, I mean, you said something to the effect of 100, I think?
It was an additional 100, which is on par with what we see during seasonal allergy season in April.
Okay, but doesn't even that didn't trigger more concern than, even though it sounds like it's same thing as pollen or other kinds of challenges, there was no other way in which you could possibly think that that was something that could trigger
the
hospitalization?
hospitalizations are not a leading indicator. They are a trailing indicator.
All right, and then in terms of the individuals who have either asthma or other underlying conditions and so on, those, how were they notified specifically? Was it just through press conferences and Notify NYC?
So I think if you look at the chart that you have here, I think you can see that we had a pretty robust communications strategy. Yes, we had the 11 Notify NYC messages. We also had a lot of interagency partners amplifying our messages. So one of the things that we did is interagency calls. And specifically, we invited and made sure that agencies that are responsible for caring for our city's most vulnerable were part of those calls so that they could make sure messaging was passed on to the organizations that they work with and to the people that are part of their communities. Those organizations include the Mayor's Office for People with Disabilities, Department for the Aging, Mayor's Office for Immigrant Affairs, to make sure that we were getting all of that messaging out to the communities that needed it.
Okay.
In addition, there was in-person outreach that was done. We did do amplified homeless outreach, similar to what we do during a winter weather or during an extreme heat. We also did a lot of interagency calls. We did the press conferences. We did social media.
Okay.
We did press inquiries. And Dr. Vassan and I also did a number of interviews with TV and radio.
How do you explain city workers, as my understanding, I mentioned DOT and FDNY, there are probably others who were working during this time period. Were they messaged in some way? You understand, I mean, each agency is obviously responsible for their own workers, I assume, but that seems to me that there wasn't a lot of communication either through the unions or through city agencies, and that they were out working. How would you explain that?
So I would have to refer you to OLR, but I will tell you that OLR issued pretty robust guidance to all of the agencies at the levels that were forecasted. It was the appropriate response based on the science, and we trust the science. And so that response was to provide the agencies with guidance, which was provided by OLR. And then the agencies, all of us have different missions. All of us have different abilities to pivot based on the needs of the people who work for us, based on the needs of the people we serve, but would have to refer you to OLR for the specific
Okay, but DOT
guidance.
workers were working in really challenging air quality conditions. Would you handle that differently?
I would have to refer you to DOT, but I think, again, we have to continue there are ways of mitigating the effects of air quality to make sure that we are continuing to provide essential services to the city. When you look at some of our counterparts in California, they don't shut down city services until they get to extreme hazardous levels.
We're not California.
Well, I would say even in our levels that we were seeing, I would not shut down essential city services. And I think the guidance that we gave was the right guidance.
Okay.
Again, I think the emergency room visits speak to that. And I think it shows something that our city was able to continue to make sure that the buses were running, transportation was continuing.
No, but
people
I'm talking
could
about
move around the
outdoor
city.
workers, outdoor specifically.
I think a
mean,
lot
we're
of
all-
essential
I just-
services in the city require people working outdoors.
Okay, I have concerns based on 9/11, still always in my head. Masks given out. So obviously you mentioned fire department, police department, neighborhood health centers. Are those the only places that masks were available? And when were they told, when were people told to be able to get masks? The reason I say that is for those of us in elected office, in the past, we were given masks that were appropriate for distribution in terms of high quality. And whatever reason, I don't know how many are in storage, but now we are only given the surgical masks, which were not appropriate for this health concern. Could you describe a little bit more about your mask distribution and why it's just limited to those three places?
So we also distributed masks to immigrant outreach centers with the Mayor's Office for Immigrant Affairs. We also, and I'm not going to get myself into trouble here, Chair Brewer, but we also did offer masks to all borough presidents. Only one of them, I'm not mentioning any names, took us up on the masks. I know Councilmember Schulman received masks from our agency and distributed them to her constituents.
Okay.
And it takes a minute to get hundreds of thousands of masks around the city. They are also now available at public libraries around the city.
All right. And when exactly were they announced as being available based on this particular situation?
I'd have to get back to you on the exact timing of
Okay.
that, and happy to.
All right. And then the other question I just want to ask is, what guidance did, again, back to this additional guidance given to people in the field? What you're telling me is nothing should have changed. They should have continued to have the fire department ceremony, and that the outside DOT workers should have been at work as they are normally. Is that the decision that you think should be made in the future?
I'm telling you that based on the forecasting abilities we did everything that we should have done in terms of the guidance, the events that took place. When you have those levels, and you're only expecting something in the unhealthy for sensitive groups, yeah, you have to provide information to people and enable them to make their own decisions based on their own specific health needs. Once we reached extreme hazardous levels, that changes things. But that's not where we were on the 6th. That's not where the forecast was until the 7th. And when that happened on the 7th, we immediately kicked into gear to address that. And I wish, and maybe this is something that we could apply more resources to the science of forecasting air quality. There's a lot of complexity to it. There's a lot of difficulty. You even look at the differences between the two recent air quality incidents that we had in the city in early June and then in mid-June. The source of the fires, the wind direction, where that air is coming from, the elevation, the time of day, all of those things change the potential for the AQI levels in the city. And so given those complexities, yeah, I think the city did the right thing on the 6th going into the 7th, and I think we then responded effectively on the 7th as soon as we saw things turn to hazardous levels.
So you wouldn't do anything differently in the future?
Of course, Chairwoman, I will always...
What would you do differently in the future?
So I think there's a number of things, and one is, you never pitch a perfect game. And one of the things we do after every single incident, no matter how small or how large, is we do an after-action report. And our team is currently working on that. And I'm happy to provide that after-action report to you and make sure that it's available to you once we've fully done that assessment.
Councilmember Hanover is also here, and now Councilmember Schulman.
Thank you. And yeah, we look forward to seeing that. And I don't know if, I'm sorry, I apologize if I'm asking a question that was asked. The protocol you're putting together, when that's finished, can we have a copy of that as well? The new protocol, because I'm looking forward to that. I do want to say, before I get into some more questions, that I want to thank you and your staff for all the hard work that they did on this. And I know, we're just, as we've all sort of stated, this is now a new normal, so we're going to be moving forward, and we would like to work with you on making sure that New Yorkers are kept healthy and safe. So I have a few questions. One is on Notify NYC, because I have the app and I'm a big fan of Notify NYC. I got an air quality alert, I think it was yesterday, but it doesn't say what the air quality is. Is there a reason for that?
I'd have to look into
Okay,
that.
it just says we're giving an alert, but it doesn't say, because I actually downloaded an app, I guess from the federal government it is, or the state, that
The
says,
Air Now, yeah.
yeah, that says what the number is, but it just doesn't say it on that, so I'm like, okay, what should I do? So I just wanted to...
Yeah, so part of it is the advisory is put in place once you're over 100. And again, I think that this changes so drastically minute to minute. The forecast is also, and I don't want to get too deep into the forecast because I'm also not a meteorologist, but the forecast is based on a 24-hour average. It's not point to point. So there is an EPA-run site, a federally run site, airnow.gov, where you can track the air quality in real time. That's actually not a 24-hour average, it's a 3-hour average, but you can also see the differences based on the neighborhood and where you are. And so, I think, one of the things that this incident has just really reinforced for me is just that as we deal with more and more extreme weather events, there is a challenge in ensuring that we are providing and educating the public. And I think this is one of the things that, we really rely on our elected officials for help with this. I think it's one of the reasons that it's so important that we have these types of hearings. It's one of the important reasons that it's so important that we work together, because if we're able to speak with one voice, it's far less confusing to the public. And there's a lot of misinformation out there currently that I appreciate the opportunity to address today, so thank you.
No, I agree. I mean, we want to be helpful. I just made the notice that on the Notify NYC, if there's just even a range or just gives a bit more information, it's just something to look at.
Yep, absolutely.
So now I want to turn my questions to DOHMH, give you a rest, Commissioner.
Appreciate it. You're in good hands.
Wildfires began throughout eastern Canada in May of 2023. The risk posed to New York City by the smoke from these wildfires was first projected by the National Weather Service on May 29th, 2023. Following suit, New York State issued an air quality alert for several regions, including New York City. When did DOHMH begin monitoring the air quality affected by the wildfire smoke?
Thanks, Chair. So as you've heard from Commissioner Esco, it's really the New York State Department of Environmental Conservation that does that monitoring and issues those air quality alerts. I think as you are aware, at the City Health Department, we have an air quality program, the New York City Community Air Survey, which is really a surveillance tool that lets us understand air quality over time in New York City, and is a tool for us at the Health Department and for the City Council to develop policies that help New York City improve air quality over time, and the Council has actually been really a national leader in that area. But it is the role of New York State DEC to do that monitoring, as Commissioner Esco has discussed.
Are you working with the New York City Emergency Management on the protocol?
The City Health Department and Emergency Management work very, very closely on a wide variety of emergencies, including this one, to prepare and respond.
Can you explain DOHMH's role in this type of emergency, just for edification?
So our job in public health is to develop public health guidance. That's guidance at a population level. We identify subpopulations that are more vulnerable. All of the chairs in your opening comments, you listed those. And to provide guidance for how New Yorkers can mitigate those risks. Here the risks are very individualized, and that's why we have been providing guidance generally about when we are in these poor air quality days, about limiting time outdoors, limiting strenuous outdoor activities, but also really listening to your body, looking for symptoms in yourself that you are experiencing impacts from air quality, taking those seriously, and going inside.
So I know that Commissioner Esco said you work with community partners too to inform and educate. Does DOHMH also work with the same partners or different ones, or how does that work?
So we know that community-based organizations, faith-based organizations can be the trusted messengers in communities, and we have very strong partnerships with scores of organizations. I'm sure there is some overlap with emergency management's list as well. We worked with them during this event. We work with them in a variety of urgent areas and in routine matters to make sure that New Yorkers have health guidance that they need.
I'm sure the list is extensive. Is there a way that we could get a copy of the list from both agencies? Because we may be able to add to it as well, so we want to just do it from a spirit of collaboration.
We can check on that, and I would reiterate that we also count on all of you to help us get that word out to your constituents.
What are the short-term and long-term health effects of exposure to wildfire smoke?
So I think that in your opening comments, you articulated those. What we are really concerned about is people with lung conditions, heart conditions, older adults, young children. Wildfire smoke can be a respiratory irritant, and so it can lead to breathing problems. And so people who already come to that exposure with vulnerabilities can experience adverse health impacts. As you heard from the Commissioner, what we saw during the event was visits to our emergency departments and urgent care centers, really like what we see in April during pollen season. For people who don't have those conditions, you listed those as well. Irritations to your throat, your nose, your eyes. Some people experienced headaches. For an extent of an exposure like we experienced that first week in June, we don't expect long-term impacts.
So, are you is DOHMH monitoring any long-term effects of the air quality on New Yorkers, especially vulnerable populations?
The work we do in our air quality program is focused on acute impacts and trying to understand those so that policymakers, including all of you, can continue to improve New York City's air quality. We do make the data available so that those who do that kind of long-term assessments of long-term impact can have that data and use that.
Thank you. I had heard some cities give out air purifiers. Is there any thought to that, or how people can use air purifiers, or even to give guidance on if people want to go out and purchase their own?
We do have guidance, and we did include this in our messaging during that June event about the importance of maintaining your indoor air quality when the outdoor air quality is poor, and there are steps that people can take to preserve their indoor air quality. We will continue to message that so that New Yorkers are prepared.
But any thought to the city giving out air purifiers?
We'll have to get back to you about that.
Okay. Let's see. Does DOHMH plan on creating any additional educational materials or media campaigns around air quality or climate-related emergencies?
So what we did do is we had been issuing guidance throughout the event, and we have now documented that on our website, and we will be pushing that out through the community-based organization partnerships and continuing to educate New Yorkers with this guidance, and we'd be happy to send you a link to those as well.
So, Commissioner Iscol, so this is my last question for this round. I know September is Emergency Preparedness Month. Are you going to institute with the materials that you usually do something about the air quality?
We are now.
Okay. Thank you.
Thank you, Chair.
Councilmember Genera?
Yes, thank you, Chair Brewer. Just getting myself together here. I just had to put in some eye drops. And my first question would be for Commissioner Iscol. In the fourth paragraph of your statement, there is a reference, and reference has been made continually since the hearing began, about the state DEC and the DEC's ability to forecast air conditions. Reading from your statement, forecasting air quality indexes, particularly for smoke, incredibly difficult and complex, and only available less than 24 hours in advance by the New York State DEC. I was a deputy commissioner for that agency for 6 years, and so I know.
Fine job.
Any discussion during that about, hey, we wish the DEC had a more robust capacity? Was that, did you hear language to that effect? Was that?
I think they wish they had a more robust capacity as well. And I think they would really lean into trying to provide us in the most recent air quality event. They would try and get us information. Generally, they put the forecast out at 3 p.m. for the next day, and then they update it the following morning sometime between 8 and 10 a.m. They would do their best to try and give us direct updates before those were put out. But I think, like us, they wish they could,
Right.
do a 48-hour, 72-hour forecast.
Right. Okay. And so thank you for that. I'm just going to make a little side note to my committee council that we should do some outreach to DEC along the lines of, we live in a new world. What was working in terms of bad air quality forecasting 5 years ago no longer works, and will make an official request to them to show us what capacity they have, and we could advocate for improved and a more robust capacity, within the bounds of science, of course. So we're going to go and do that.
Yes, sir.
And so you're okay with that, right? That makes sense? I want
Sure.
them to do
Yeah.
a better job, okay? And so, and like I said, I have good relations. I have good relationships with that agency, and maybe they need to do, they need a more robust capacity. And now I have some questions for Deputy Commissioner DeFalco from DEP, with whom I am good friends, and as I am with everyone at DEP. And we got the Plan YC process, which is separate from what's going on here, but, interrelated, because Plan YC is all about sustainability and resiliency in the face of climate challenges. and if you could expand a little bit on how Plan YC intends to identify and address various manifestations of climate uncertainty, including how that uncertainty could manifest into emergency conditions. Could you speak about that a little bit?
I can. Thank you, Councilman. I think that the chief areas that we are really focused on, and I know that we've given an overview to your committee on Plan YC
Right.
Recently, is how we prevent pollution from starting in New York City, whether that's electrifying our city-owned car fleets, reducing emissions from commercial cookware, or whether, adding a $136 million commitment from this administration to planting more trees, which include air quality. So we've taken a multifaceted approach to ways in which we'd like to both protect and improve New York City's air quality.
Yeah, and we do appreciate that, but perhaps we may be able to sort of, push out the boundaries a little bit of Plan YC to think about external climate emergencies, so to speak, and perhaps their impact on vulnerable communities. I remember when we reinstituted the New York City Panel on Climate Change. It was brought into existence by Mayor Bloomberg to look at city infrastructure. Then it went out of business, and then my committee back in the day brought it back into existence, gave it a broader mandate, to look at the city's economy, impacts on the economy, impacts on vulnerable communities. I think perhaps last month's event could be a teachable moment about how we could push out the boundaries of Plan YC to include and capture how climate emergencies are going to impact the most vulnerable communities. That I think is like a forward-thinking way, because you got OEM, and they deal with emergencies. Bang, it's happening real time. Scramble the jets. Let's do something. But I think I think people looked at Plan YC as kind of like the visionary climate document and roadmap to how we navigate climate uncertainty. And now we've seen it, cross the border and come and hit us, and probably impact vulnerable communities, more than other communities in the city. So what I'm calling for is for, Plan YC and the body that advises Plan YC, on which I sit, to kind of add this as an agenda item for how Plan YC can be a more encompassing planning document and roadmap for climate emergencies. That's what I think. Do you have something to say about that?
No, I think that we 100% agree that environmental justice communities are impacted far more greatly than other communities by smoke events like this and pollution events like this. They're less able to respond quickly, right? We know environmental justice communities, they're less likely to have air filters, in the home or in the office place, and are more impacted by the air quality of local businesses, and especially those are in industrial areas. So yeah, take what you say wholeheartedly, and we'd love to work with you on that.
Okay, and someone was taking notes, right? So we got this, right? Good. And
It's all being recorded, I hope.
What's that?
I think we're all being recorded, so
Yeah,
we'll make sure that
we're definitely being recorded. And so, Madam Chair, as I wanted to be brief with my questioning up front. I reserve the right to come for a second round, but we have other members here that are very eager to get their
Very eager.
their questions in, and I always like to promote their ability to do so. So I'm going to step down for a while. I'm going to be here for the whole day anyway, but I want to hear from some of my colleagues. I want to thank this panel, and you haven't heard the last of me before you step down, but for now, I'm turning it back over to you, Madam
Thank you.
Chair Brewer.
Thank you very much. Councilmember Feliz is here. Now we'll hear from Public Advocate Williams.
Thank you, Madam Chair. Much appreciated. And thank you, Commissioner and Deputy Commissioners, for that. I just want to make sure I understand, because based on the testimony, it seems that what you're saying is that given the information and circumstances as they played out, the city did the best it could. Is that accurate?
100%.
Okay. Which worries me and troubles me a lot, because that means given the same set of circumstances again, you would do the same thing. And that's where my frustration comes in, because I think the administration is the only one that believes everything went the best way that it could. And so I want to walk through a couple of things to understand and make sure we're on the same page, because it's my belief, and I said this before, if the mayor and the commissioners are giving a press conference a couple hours before the sky goes orange because of how bad the air quality is, then we have failed at communicating. And I say that because air quality is not something that is usually talked about in the public. It's something that the public has to learn about and understand. I'm sure we would all agree on that. In that case, we'd have to prime the public so they can understand the information that's coming to them. So if we got information on the 2nd that air quality might be bad, I don't think we did a good job of explaining to the public what that might mean to them. And what you're saying, if I understand correctly, is most of that communication came from Notify NYC, maybe from the 1st or 2nd to the 7th. How would the general population, including the ones that are sensitive, get information about what the air quality was and what that actually means for them?
So first off, Mr. Public Advocate, I appreciate your questions. I appreciate your care and concern. Read with great interest the report that you and your team put out yesterday. Appreciate our ability to talk yesterday. As I mentioned in our call yesterday, I wish that you and your team had actually sat down with us before putting this report out. A lot of the information in it is factually incorrect. A lot of it is stuff that was done and has been done. A lot of it points to existing or what would be redundant capabilities. And I think it's important for us to have these conversations to make sure that all of us are on the same page, because it is confusing for New Yorkers. And it is really important that we are all speaking with one voice so that they have the clear information. As I've said during this hearing, Notify NYC is not the only public messaging system that we have. We do a lot of things through community-based organizations. We do a lot of things on social media. Dr. Vassan and I did a lot of press, both radio and television, and other interviews.
On which days?
I could get you a list of...
No, this is important.
This
is very important.
Right,
and I wasn't going to bring up the conversation. I'm glad that you did, so I can talk about it. Now it's public. You also said we always don't bat 1,000%. And so that's important to point out as well. I would love to know which press was done from the 2nd to the 7th. I'd like to know which community organizations you reached out to from the 2nd to the 7th to get this information up. I hate that these conversations have to get tense, because we should be looking forward. I think there's a lot of things we agree we can do forward. But this is important because we've been pushing a better way to communicate to the public since COVID, and we don't have it. And we're saying that we communicated to the public the best way we could have from the 2nd to the 7th, and the public would disagree with you because they had no idea that there was a problem until the sky turned orange.
With all due respect, you're missing a key phrase there.
Okay.
The key phrase is, we did the best communicating to the public with the information and the forecast that we had in hand.
And that's just not true. Okay, so wait. There are
completely
other ways to
disagree.
communicate. The mayor himself has said that Twitter is not the best way to
You're
communicate.
saying, Mr. Public Advocate, that you have a better forecasting tool.
Okay,
than
so
what
let's
is
go
available
through
from
the
DEC?
forecasting. What information did you have about the air quality from the 2nd to the 6th?
So I can tell you that the air quality index forecast for June 6 was in the unhealthy for sensitive groups category.
Great.
The air quality forecast for the 7th was also in the unhealthy category for sensitive groups. The exact numbers for the DEC forecast for June 6 was 118. For June 7th, it was
Great.
138.
Let's stop right
June
there.
7th
Got it. Let's stop right there.
I want to make sure I'm addressing your question.
No, I got it. I have
The
enough of
day
my
that
answer.
we had
Thank you.
the
So wait, no, because that is not incorrect. So that is factually incorrect. So one, just so we're clear, if we're saying that public who have sensitivities were in danger, which you're saying at some point they might have been, that was not communicated. And it was not communicated effectively because, as the mayor says, Twitter may not be the best way to do it, and Notify NYC is only reaching 1 million people. You're saying you reached out and could have reached out to TV stations and to CBOs. I don't think that happened. And what I'm saying is, even if we didn't know how high it was going to go, there should have been some priming so that people could know what might possibly happen. Let me just end with this because my time is up. On the app right now, if you go to Air Now app of NYSDEC, it says on the screenshot that I have that the air quality for June 6th was 165, 155, 156. The mayor's statement that came out on June 6th said it was 218, which means it's going into the general population. The Yankee game, it was put out and started at 7 o'clock. That air quality was over 150 as reported by the fan favorite of the administration, New York Times. It went up to over 200 by the time the game ended. CNBC also reported some of this. What I'm saying is...
I'm sorry, I'm confused.
Sure.
You're saying that the air quality reported is not as bad as we're saying it was?
No, I'm saying on June 6th.
Right.
There's reports...
The actual, I just want to make sure I understand this.
Sure.
You're saying the actual, so there's a difference between the forecast and then observed.
Yes.
Right? The forecast is what we will predict will happen in the future.
I understand the forecast.
Observed is what actually happens.
So there's two things. Wait, hold on.
The observed.
What I'm saying, the two things. The forecast was saying there might be problems with air quality. That's one. We don't know how bad that was going to be, so I'm giving you that. What I'm saying is that the forecast, we should have provided more information publicly in public spaces so people could understand what that means. So do more with the information that we had, and we didn't do that. The second part is, as it was happening, as there was actually fog in the sky on June 6th, as the app was saying that the air quality was getting worse, as we were seeing that this was happening, we should have done more with that actually at the time in the first press conference. And I'm simply saying we should have done more with it, and we didn't.
Sure, with 2020 hindsight, of course we should have done more.
I'm talking about hindsight.
But I think with the information that we had at the time, the mayor's press conference occurred on the first day we had hazardous air quality.
No, the first day was 218 by the mayor's statement.
218 is not hazardous air quality.
At 218, wait, I just want to read this. When the air quality is 150 to 200,
is unhealthy
some
for
members of the
sensitive
general public may experience health effects. 201 to 300, health alert. The risk of health effects is increased for everyone.
And if you look at what that actually says in terms of the categories, 150 to 200 is unhealthy for sensitive groups. Above 200 is when you get to unhealthy for the general population.
218.
Excuse me. Above 300 is when you start to get to hazardous levels of air quality.
I understand that.
And
but,
again,
and I'm going to end. I'll get back to the chair. But what I'm saying is this: we have to prime the public for information that they have never received. And so this information is confusing. If we're starting to give this information right before the sky turns orange and on fire, I'm just saying we took too long. That should not be a statement that is somehow controversial. And that's what frustrates me with the administration. There's never an admission of the simplest things that we could have done, and it makes our conversations tenser unnecessarily. And this is not criticism to the mayor or the administration for criticism's sake. As he said, this is literally my job.
Right. I think one of the things that I look at is, and I couldn't agree with you more in terms of priming New Yorkers. I agree with you 100% on that. This was something that had never happened before in New York City. One of the things that we are doing now is robust communications to start educating New Yorkers. We do this about heat. We do this about extreme rainfall events. And now we're doing this about air quality, things like this, so that we are priming that ahead of it. But to think that we could do that on the 6th with the forecast that we had for the 7th,
you could not have.
we could not have. And
Agreed.
I want to be clear about that. But
So
I
we're
agree
clear on
100%
that. But I'm
with you.
talking about the information that we had. And so we're using the excuse of the information we didn't have. And I'm talking about the information that we actually had on the 2nd through the 6th, what we could have done more of, and how effective we could have gotten it to the people that needed it. That's all I'm talking about. And so we're hiding behind the fact of the information that we didn't.
Nobody is hiding behind anything here.
Okay, I appreciate the time that I've had. Thank you so much. I definitely look forward to more of our conversations.
Thank you.
I do too, and I do look forward to sitting down and talking about your report. I do really wish your team had sat down before issuing this with my team.
Yes.
Okay.
As I said, the
Thank
administration
you.
doesn't admit
Inconsistencies
when
and
something went wrong,
misinformation.
Thank you.
so that makes it more
Thank you.
difficult.
Thank you. Councilmember Arola.
Thank you, chairs. Thank you all for coming today. So maybe I'm unique in that we were watching for tweets on Notify NYC, so we were aware when you first started to send them out, so thank you for that. We were then contacted by the mayor's office, NYSM, the city council, emergency services. We had ample information regarding what was and what could be coming. So what I say is, if you're paying attention to what Notify NYC is putting out, and you're paying attention to the emails that are being sent to you from all the different agencies, including the administration and our city council office, then you would have known, and you would have started posting on Facebook and all your social media, or reaching out to your constituents. So in that area, I disagree. I think that this was something that came upon us, and the city reacted, and you reacted well, and you did your outreach. NYSM, DOHMH will get to you. So Commissioner Esco, last month's air quality issues was novel for NYC. What protocols and procedures does NYSM have in place to address new issues that arise in real time, and how did you employ these during the week of June 6th?
Yeah, thank you. It's a great question. So I think one of the things is to really talk a little bit about all hazard planning. You know, in emergency management, we're always going to have to deal with things that are novel and new, right? We cannot predict the future. And so we have a construct with the way that we do planning where we have essentially plans that enable us to, let me give some examples. So example, if you look at like our coastal storm plan, for example, that's comprised of maybe two and a half dozen different plans. Our advanced warning system, our bridge and tunnel closure protocol, our disaster cost recovery plan, our disaster assistance service center plan, our language access protocol, our logistics center plan, our debris management plan. All of our plans are made up of a whole host of other plans. So what we're able to do is we can look at the impacts, and then from there, we can then activate different plans to do that. And that's what we did during this event, whether it came to health concerns, educating the public, distributing masks around the city, the commodity distribution plan and logistics plan. Those are the protocols that were in place. Now one of the things that we're doing is codifying some of the lessons from the actions we took and codifying into what's called an actual air quality protocol that is currently in development.
That's great. And honestly, our office is one of the offices that was contacted for masks, and I want to thank you for that. And it is only natural to use first responders for locations for people to pick up masks, and that's why I think that was what was chosen first, and then it went to other locations like public libraries. So my second question is, while none have been as bad as this week, the week of June 6th, what we're discussing today, we have had some days of poor air quality in the past few weeks. What strategies did NYSM employ to notify the public and work with all city agencies on appropriate actions?
Yeah, thank you. So number one is, again, Notify NYC. I know a lot of folks are bashing in Notify NYC during this panel, but it is our primary messaging system, over 1 million subscribers, 14 languages. It's what we used during COVID. It's what we used during emergencies to get information out there. We use social media. We use radio, television, and TV ads. I think we also have community-based organizations that we work. And again, one of the things that we did during this event is, and I can't emphasize this enough, we brought in partner agencies that are generally not at the table for emergencies because they're not the operational agencies, like Mayor's Office for Immigrant Affairs, like Mayor's Office for People with Disabilities, like Department for the Aging, and others, to make sure that they had the right information from the scientists, from the doctors, from Dr. Katz, from Dr. Vassan, from the DEP commissioner, and making sure that we were providing them the right guidance so that they could get that out to the organizations that they work alongside, to the people that they sort of were responsible for caring for, to also make sure that we're hitting it through those channels as well.
Thank you. Now, for DOHMH, what was the type of outreach that you did? Because we didn't receive any from DOHMH.
So the health department complemented the outreach from emergency management. We were tweeting in English and Spanish. We were using our networks I described earlier of community-based organizations, faith-based organizations, to get messages to them so that they could communicate to their constituents. Our commissioner did a lot of press, which is a really important way to communicate with New Yorkers. So I think those would be the primary ways that we communicated.
And do you believe that DOHMH's response was adequate in this air quality emergency? And what do you think could have been done better?
Well, I think you've heard from Commissioner Esco about all of the ways that the city responded. The health department was there to provide the public health guidance as the city responded. We were looking, I think there was a question earlier, we were looking to the guidance that's issued out on the West Coast to the more experienced jurisdictions to make sure that the guidance that we were issuing was aligned with what they tell their residents, and it was. So I am really proud of the work that we did in a very, very rapid way to put out guidance to New Yorkers for limiting their time outdoors, limiting strenuous activity outdoors, ways to protect indoor air quality.
And will you be putting, thank you, and will you be putting anything out saying that, I have respiratory issues, so, of course, then I went to see my pulmonologist afterwards because my breathing quality, and I only have asthma, so it's not anything, anything that's COPD or emphysema or anything like that, which are much worse. But do you have any idea what the impact will be on people with respiratory diseases that now that we have inhaled, that type of smoke?
So we're really concerned about acute experiences when we have that kind of exposure. For the length of time that we had this very poor air quality, we are not really concerned about long-term impacts. I can say another area of outreach, since you mentioned your healthcare provider, is we have a vast communication network with healthcare providers, and we communicated with them as well so that they would know what they might be seeing, hearing from their patients, and how they could help their patients.
Thank you.
Good, thank you.
Okay. Councilmember Yeager's here, and now we're going to hear from Councilmember Nurse.
Thank you, Chair. I had a question about masks, and going through this experience just kind of made me a little bit anxious about the fact that the last 3 years we were relying on this piece of equipment to really keep people safe, and so I'm just wondering if you can discuss what are the current stockpile levels that you work to keep. And can you discuss the process and protocol for rapid deployment and any lessons you've learned from that? Where are they stored? What are the triggers to move them? Where do you stage them for an anticipated or very likely need to distribute them?
Yeah, thank you. It's a great question. So we have a lot of masks located in a lot of different locations. So we have some at our warehouse in Brooklyn. We have another warehouse where we have most of our coastal storm sheltering equipment and supplies in New Jersey. We have DCAS at their warehouse. They have a lot of masks. FDNY, NYPD, they also have masks. And this specific incident, essentially what it was finding out where do we have of all the different stockpiles of masks. And I can get you sort of more of the specific numbers of different mask stockpiles around the city and outside the city. But what was going to be the fastest way of getting masks to the public? And what we determined was it was going to be at NYPD precincts and FDNY firehouses. And we relied on a stockpile of, I think, 25 or 50,000 masks that we had at our warehouse. And the numbers, and I think it was maybe 125,000 masks at a DCAS warehouse, that those were going to be the easiest ways. DEP, actually, I think DEP might have also participated in providing masks in that distribution.
What is your current stockpile number goal that you try to keep at all times?
I don't have that off time plan, but I can get it for you.
Okay.
And it would vary also, I'm sorry, by agency, not just by the city.
So each agency is responsible for their own determination of a stockpile.
There's sort of stockpiles for city agencies. There's stockpiles also for New Yorkers and for these types of events, and so there's both for city workers and for New Yorkers. But I could try and
Who
get my
would give
team
the ultimate authority over what the city should have in total?
So there are
Or where would that guidance come from?
Yeah, I'd have to get back to you on that. I mean, do you have guidance on that from Department of Health in terms of masks? No? No, I mean, there's city policies. I'd have to go back to my team and find out if there are certain federal or state requirements for masks as well.
Okay. Can you, I don't want to, I'm not trying to reopen what the exchange with a public advocate. However, I am curious in terms of walking back from the prep, like priming people internally, not even to the public, priming agencies. So if you know you're going to, at a hazardous level, you're going to close schools, at what point on this scale do you start to communicate to DOE and different agencies, start making preparations for a potential closure, start making preparations for staff to work remotely? Where in this do you start that trigger process?
Yeah, it's such a good question. I'm going to defer this to Department of Health, who can talk about this, but I just want to ground this in, like, I can't emphasize this enough. Because we're doing a lot of work now looking at different triggers.
Yeah.
And I think just the imprecision and the poor reliability of the forecasts, the length of time that you might have,